a lot of questions on floaters these days. And actually, I'm doing a thought or a lecture because this blue light that's emanating from these monitors and things are
Mm-hmm.
increasing your eyes, but it's also causing damage to the retina.
Hello, and thank you so much for joining us for Shot Callers. I am Carrie Bigford, TFEC's Outreach Director, and I am joined by a wonderful guest, Dr. Seema Nanda. Dr. Nanda is a clinical professor at University of Houston College of Optometry. She is a faculty advisor with the Young Conservatives of Texas at the University of Houston. She is a national delegate at the Republican National Convention. She is a member of the Right Docs of History group. She is a co-host of the Freedom Radio Show. She is an author of patriotic poetry books and an inventor of the Nanda Ocular forceps. She is an incredible woman, and I am so happy to welcome her here today. Thank you so much, Dr. Nanda.
I'm an incredible audience with you, Ms. Bigford, because without you, I don't know I would be here talking to you because of what you've done and making choice a good word again, and having that option of choosing to put something that we don't know what's doing to our bodies, and now we're seeing it, especially ocularly. I don't know if your audience even knows what's happening to the eyes with these. I don't call it a vaccine. I really call it a viral injection because all you're doing is injecting a particular part of the virus into the body, and that is replicating at phenomenal rate and causing a lot of damage to different body parts, including the eyes.
Yeah, you are the first doctor that was an optometrist and a medical liberty fighter that shared with me that there was even a connection between COVID vaccine injuries and eye problems. Could you share more about what you've been seeing in your practice?
I wish I didn't have to, but I guess we do. In fact, I've even written it because I am a professor and I also teach doctors. I've taught thousands and thousands of doctors throughout the United States, given over 500 lectures internationally on eye disease. And when the world shut down, instead of being able to travel and teach the doctors live, I created my own, heard it through the grapevine, CE or continuing education. And I've been teaching that online since the world shut down Friday the 13th, March 13th. And I created this on March 31st, inverse, boom. And every single week, I've been teaching different things about ocular disease. Now, when I started seeing things when the vaccine was rolled out, they never add 2 + 2 = 4 anymore. It's like, is it causality or is it coincidence? Well, I'm having a lot of coincidences that keep happening in my practice. And then I thought I should share that with other doctors because it's not just me. It can't be. And, when the world shut down again, I had to start my own practice. Everything changed. I was in a large multidisciplinary ophthalmology group, and I just saw lots of different things that were happening, and I said, I can't do this anymore. I've just got to do my own thing. So not the brightest idea to open a practice in the world shutting down, but hey, God provides, and I've been very thankful for him because I've now got to do what I need to do to help these people, and they're just finding me from everywhere. So one of the things, so let's just kind of delve into, wait, do I have I do. Do you mind if I share my eyeball with you? And that way I can explain things a
You
little
can
bit
share your eyeball for sure.
better. Okay.
Thank you.
This is the best way to explain it because, as a professor, it's not just doing it. It's see one, do one, teach one. Here's my eyeball. So, the lens just shifted in flight. But anyway, so just to give you just a kind of a basic 101, because I realize a lot of the times patients don't know the cornea from the retina, from the front to the back. So I just want to give a quick little overview. So the front of the eye, this is the clear part. That's the cornea. And behind it, you have the colored part of the eye, which is the iris, which makes me brown-eyed and you hazelish, blue, green, whatever.
Yeah, blue, green.
Blue, oh, yeah, something. Anyway, so each one of us is different. And then if I, decapitate this guy, this is the lacrimal gland. It's not a tumor. Oh yeah, I kind of do my accents. But anyway, so this is the lacrimal gland. It sits behind this frontal bone, which produces the tears and coats the cornea. If I, like I said, decapitate my little guy, if I can. sometimes he doesn't want to come apart. But anyway, unlike the vaccine, which is causing everything to come apart. Well, I can't get it apart. But anyway, so behind it, inside, is the retina. And the retina is supplied by blood vessels, which comes off the heart. So the heart comes in the aorta and everything, and then you've got the internal carotid, and that goes in behind the eye and creates off to the ophthalmic artery. So what have we been hearing the most of? Dr. McCullough's been, oh, here we go. Dr. McCullough's been teaching us from the beginning about the heart. So what's the biggest thing that they've seen?
That the blood clots and there's myocardial and pericarditis damage.
Exactly. So if this is shooting off the heart, do you think clots could just get stuck other places too?
Right.
So this is what's
Okay.
happening. So when
So
it's
it's that
coming up,
same mechanism of function.
right, exactly.
Yep.
So when these spike proteins are, aggregating, coalescing, congregating, having a party when they're not allowed, right, and over proliferating, they're shooting off to that, like I said, that internal carotid back to the back of the eye where the ophthalmic branch is, where the nerve comes from here. So it's coming into the back of the eye. And what's happening is the smallest vessels in the body are in your eyes and in your toes. I am not going to check anyone's toe jam, not happening. But I will look in the eyes. And guess what? The only part of the body that you can look in at a functioning blood flow without cutting into the human is the eyeball. So
Really?
when you dilate the eye, make it big, you get to look inside the blood flow of that patient without having to cut into him. So, what am I seeing? Tiny little hemorrhages. Okay, hemorrhages are breaks in the blood vessels and clots that are forming. And it might not necessarily be at the center part of the eye. It could be way out here to the side because blood vessels are everywhere around the eye. It gives the nutrition, gives the body it's nutrition. It gives its
Yeah.
way, it's got to bathe it, it's got to give its food and everything like that. But if you stop it, if it's like a roadblock, you've got the intersection, everything's going, the bifurcations, everything, or the roads that are splitting off into different forks, and then all of a sudden there's like stop, there's an impediment, somebody puts this block in the road, then you don't get the blood flow. And if you don't get the blood flow, and if it's in the center part, then all of a sudden the patient's like, I don't see anything anymore. That's pretty scary. And that's
So it's
all.
been sudden onset blindness almost?
Yes, and I even had another
Wow.
I had another she was a nurse actually, and she was in Idaho, and she told me she was at the gas station. I think she was wearing her scrubs or something like that, and she told me that the person at the gas station told her, "Oh, one of my relatives went blind in one eye because of the clot that happened." And this is a random stranger, but what did Will Rogers say? A stranger is just a friend I haven't met yet.
Yeah.
So we're all on this planet together. We're all here to help each other. And I find it odd that somebody would go, they say, against the narrative. If you go against the narrative, what's the narrative here? Saving people, saving people's vision, saving people's. Nobody's out to hurt anybody. It's like, don't shoot the messenger. Just because you don't agree with me doesn't make me wrong and doesn't make you right. It makes me, I'm trying to just help. So that's all I can do. If I see something, I don't just say, yeah, I don't want to look at it. It's just coincident. I can't do that. Another thing that's happening is the front of the eye. So the front of the eye is the cornea. Now, the cornea is the only body part that has no blood vessels to it. Now, that's even interesting. The eye is just the most fascinating creature, I think. It is just amazing. So now you get the blood flow from the back, from the heart and everything, and the front of the eye doesn't have any blood vessels. So how does it get its oxygen? It gets it from the air. So you get the oxygen from the air. So you don't need blood vessels because blood carries oxygen, and that's how it gives our supply. That's how we breathe. Every part of our body needs it. The only part that doesn't have it is the cornea. Okay, so what's happening then? If you have a patient then who gets a transplant, meaning the cornea is removed, the damaged tissue. Let's say you poked yourself. I had a patient who had a tree branch that poked them when they were a kid, and it caused inflammation and maybe a fungal infection and whatever, and his cornea turned white. Yeah, that's not a good scenario. But anyway, so what would happen is they would have to remove the damaged tissue, get the donor tissue from somebody who just passed away, and put it on the eye. Now, the chance of rejecting is almost nothing. Okay, you can't ever say 0. That's just not the world.
Right.
But it's very, 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 how many varies can I put? Extremely low chance of rejecting. Why? Because there's no blood vessels going to it. Now, if you got a heart transplant, then what will happen is that the body will recognize that's not my heart, and it will attack it and try to get rid of it. So you put them on drugs that will suppress the immune response so it won't attack it. Those are called immunosuppressants. And that came out, a big one came out back in 1985, which is like the cyclosporin and everything like that. So another history. So in and of itself, the cornea is very resilient to being rejected. However, what happens when you have a viral injection that's put into your body? Because if you look at vaccines of original vaccines that were made, they were attenuated or weakened versions of the virus, a weakened version of mumps or rubella.
It was a
or
viral vector virus. I mean,
Exactly.
a viral vector vaccine, right?
Exactly. So it's attenuated, it's weakened, it's dead. Some in cases it's a dead virus. Sometimes it's just a very, very weak. And so the body seizes it as foreign and then attacks it because it can't. It builds up that immune response. It's that lock and key. It attacks it. This is different. You are putting a potent, strong, virulent form of the virus into the body, and the body is already weakened because maybe it already had the exposure before and it hasn't built up its immune response. So now you put this virulent, strong version of the virus and the body is trying to fight it, but that viral injection is spreading like wildfire. So the immune response goes hyper. Okay, it goes like on overload. So what's happening now is the patient who had the transplant, let's say 20 years ago, is now all of a sudden losing the transplant. Their vision's going, the transplant is rejecting. And there's a study that was shown in 23 of 25 eyes, or is it 21 out of 23 eyes, rejected cornea transplant. This is unheard of, all because of a hyperproliferation, a hyper immune response trying to get rid of a virus that's in the body, and now the cornea is rejecting. It
Is
just
there
blows
any
my
way to, I mean, absolutely, I agree. The proliferation of the spike protein and the new nature, the novel nature of this, injection, I can't even call it a vaccine also, it's not a vaccine.
Right.
Is very
Well, not in the
alarming.
traditional sense, for
No,
sure.
yeah, it's not in the traditional sense. No, it's an entirely new take on an old product. What can be done? Can anything be done for the issues with the retina or for the corneal transplant rejection?
Right. So, I actually, that's it's it's a question I ask myself every day, and I'm not the person. It's funny because when you have a doctor, you always say, "Okay, take this med and don't call me tomorrow," right? Or take 2 of these or whatever. I've never been somebody who's pushed any type of drug or medicine unless, well, I'm just not that person. I think I grew up in a home that, if you had a headache, you lay down or you ate a sandwich because your blood sugar's low and you probably don't have enough. And that's why, that's the way the body heals, right? The body does take time to heal. So you've got this in you. We were duped, right? We were all duped. So we've got to figure out a way to slow it down, and we've got to wait to increase our immune response to fight back. And I call it the ABCs. I actually did a lecture on the ABCs of diabetes, and it came up. I just kind of thought about it, and I go, you know what? There's probably the ABCs of dealing with long COVID, because long COVID is really not long COVID. I mean, it is, because it's COVID that won't go away, but it's because of the injection over and over and over again. And we're at the 8th version. There's an 8th booster out now. 8.
Yeah. I remember hearing in the beginning that there would be 8 boosters. Yes.
Right. If the first one didn't work, what do you think 7 more is going to do to you? Really? I mean, when I was a kid, you took one and done. Okay. I don't understand. And then the people say, well, they're just looking out for us. Well, no, they're looking out for their ching-ching pocketbooks, because they're the ones really making money off of this.
Yes.
So I'm anyway, I don't want to get on that soapbox. My point is, so what can we do? What are the things that we can do?
Mhm.
Well, if I think about, like I said, the ABCs, one of the things is, an apple a day will keep the doctor away. Well, what's an apple? It has something called
Mhm.
quercetin, Quercetin.
Right.
I hope I spelled that right. Anyway, so quercetin, that's another thing that will help the immune response and help you get rid of it's not necessarily get rid of the infection or whatever is in you, but it'll keep your immunity up so you don't have to, let's say, worry so much about it. And that the other thing is worry is terrible. You stop.
Mhm.
Just put your faith in God if you believe. If you don't, then God help
Mhm.
you. But anyway, literally, right? Anyway,
Right.
but you really have to, what is that faith over fear I keep hearing about? I think
Mhm.
that's absolutely brilliant because your immune response will go up because of your strength. So
Mhm.
the second thing, B for berries. Berries
Mhm.
contain polyphenols, anthocyanins. These are all fancy words, but these are antioxidants, will help you stay healthy and beautiful and everything. C, vitamin C. Now, everybody knows vitamin C is something that we need on a daily basis because it increases immunity. Anytime you get sick, they always tell, drink some orange juice. Well, no, I would stay away from the orange juice because it has toxic chemicals like glyphosates and things like that. If you want
Mhm.
to squeeze an orange and put it in some water and have an orange drink, that's fine. Squeeze a lemon, squeeze a lime, that the vitamin C in that in itself, it helps. Everybody pushes supplements. I'd rather have my food as medicine instead of a supplement. That's just me. So if I'd like the flavor profile anyway, right? So I like to eat good food. I like that. I like the way it tastes. Stay away from packaged items. Packaged items they put locusts in them for goodness sake and insect guts. I am not eating something that says, yellow dye number 9, whatever it is. Those are the things that are going to kill you. You don't want those things in a package. You want the things as whole foods, right? The product that itself. Anyway, I'm going on soapbox. I don't want to do that. D. What can we do for D? Vitamin D, specifically, the D3 if you're going to take it as a pill. The best way to get vitamin D is what? Sun.
Sunshine.
Yeah. Put
Yeah.
15 minutes outside in your birthday suit and you get most of your skin exposed and well, you don't want to wear your birthday suit with your neighbors looking, but maybe a bathing suit or something. But you want as much skin exposure just to have the
Mhm.
15 minutes of UV rays. Now, what do they always say? Oh, UV is bad. It's going to cause cancer, blah, blah, blah. Well, you know what? They did a study where the Western diet versus a very healthy diet, those individuals on a Western diet with burgers, fries, and, anything that, comes packaged and stuff, and they put them in that with this UV sunlight versus a patient who doesn't have it, those people who had the Western diet are the ones who ended up with the cancer. Those people who didn't have the
Mm.
Western diet, who had a clean, healthy diet, never had cancer. So it's the
Mm.
UV's triggering that's causing the skin cancers and
Right.
whatnot. So that's just a misnomer. So the sun is not a bad thing. Now, baking out there for 10 hours, yeah, that could be probably some, damage on you. But
Right.
look at Mel Gibson. That's all I got to say. That guy used to be so good looking and now he's like wrinkle. Anyway, never mind. All right. So now, yeah, D3, D. Okay. So, E, what's E? Eggs, but not eggs specifically. It's egg yolk. Again, a
Hmm.
study in 2021 showed Chinese scientists showed that the actual egg yolk neutralizes the SARS-CoV-2 virus, the yolk of the
Huh.
egg. Yes.
I hadn't heard that before, and all the things I'd heard.
Yeah. Oh, I can share the
Okay.
article with you. Yeah.
Yeah.
Yeah, I have everything I'm saying is evidence-based. It's not just me coming off the cuff. It's
Oh, I
everything that's
know
saying
that.
yeah, but it's just stuck in
Hmm.
my head because, I have to
Hmm.
tell patients all the time, "Okay, tell
Yeah.
me what's wrong. Tell me what's wrong. Let me see if I can help you." But egg yolk neutralizes the virus, and that's why they
That's.
what? Oh, everybody has to have egg white omelets. Well, the white
Uh-huh.
of the omelet is not going to help you. It's the yolk. And
Right.
you, in another study, showed that you can have 1 to 2 eggs every single day, and it does not affect heart health. Actually, it
Hmm.
helps you. It's such misnomers that we've been told, and they're all
Mhm.
lies. And you've got to really dig in deep and figure out who do you trust? That's the
Mhm.
thing. And don't believe anything that I'm saying. Do your own research. Look it up. It's amazing how much is out there. Do your PubMed research, type it up, and look. You're like, wow, egg yolk. That's really good for you. All right, so egg. F, fish. Fish has always been good for you. Of course, they always say, oh, you don't have too much fish because you're going to have mercury toxicity. Oh, my
Mhm.
goodness. There is so much nobody's telling you to eat a whole gallon of it every day. Just have a little bit, holy
Mhm.
mackerel. That's what the M is. M. Mackerel is good for you. Maybe
Mhm.
that's why it's holy. Anyway. All right. So fish. G. Garlic. Garlic
Mhm.
is God's immune capsule, right? That little clove of garlic is so healthful. Is that a word? Healthful,
Hmm.
healthy,
Yeah.
will help you keep your immunity up. But nobody wants to, smell like garlic all day. And I have patients, I don't want to breathe on them or that. But what I do is I put it in honey. Now, honey, they said,
Mm.
well, that's sugar. That's bad for you. No, no, sugar is sugar. This is honey. Honey is different.
Yeah.
Actually, honey has been shown to actually help patients who are diabetic. Another study showed that. You put
Hmm.
the cloves of garlic into honey that is in your neighborhood. So don't get something that was New York City. Get something that's in your own backyard. Get the honey that's local. Okay. If you can find a bee apiary, that would be great. If not, then you can even go to your store and just look for like I'm in Texas, so I look for honey here. But I actually have a patient who told me she has her own bee farm, whatever it's called, not ant farm,
Awesome.
but bee farm. So I get my honey from her because it's locally based from Houston, so it's great. So anyway, digress. So you fill it up, the cloves of garlic, you pour the honey in there, and then you let it sit about a month or so, and that will cause that honey to get the garlic in it. And so you've got this garlic honey, and you take 2 spoons of that every day, and there's your medicine. If you are all about medicine, there's your medicine. It's natural. It's in your backyard, so you've now got the immunity of everything around you. And I'm not a sugar fiend, like that sweet taste. I don't like to say
Hmm.
so. Honey to me is very, very sweet. So this kind of
Hmm.
tamps it down and has that neat kind of garlic thing. And you probably could cook with it too if you want to make some kind of.
Yeah, it sounds delicious. Would you like
Yeah.
fill up like how many garlic cloves to
I
honey
just,
ratios?
I
Just
just,
fill it up.
whatever. I just keep pouring in. I'm like, because sometimes I'll eat the garlic clove itself because it's
Hmm.
it's not as strong because now it's infused with the
Yeah.
honey. So I'll cut it up and eat it. So when I start seeing this going low, I'll just put some more in there. There's no right or wrong. This is going
Okay.
thousands of years, Ayurvedic generations, just thinking of that. Our ancestors really took care of themselves, and before they had the Rockefeller medicine, that basically is everything is petroleum oil based,
Hmm.
and cancers didn't exist before that, and
Yeah,
which
everything
is
is synthetic now.
yes,
Yes.
exactly,
Mm.
everything is, and we just got to go back to the roots, right? We got to go figure out. And if you have grandparents that are still alive, man, pick their brains. Say,
Hmm.
hey, what did y'all do when you had a head cold? Well, we stuck
Right.
ourselves in a steam and we had, all that stuff. And yes, it does take longer because it's homeopathy as opposed to
Right.
allopathy. It's homeopathy. So it does take
Hmm.
longer. But even if it takes longer, there's less side effects and you will feel
Right.
better. And then your
Right.
immune system is now up so that you don't even have to, think about it the next time because now it, it just kind of goes dominoes effect because now your
Hmm.
immunity's up. So the next time you're bombarded with
Yeah.
somebody coughing or breathing on you, I seldom shake hands anymore. I was like, namaste, right? I don't
Hmm.
shake hands because I know you can get even, verruca or viral warts from a
Yeah.
person just shaking hands. So I would just kind of stay away from that and just I'm a hugger though. Come on, give me a hug, whatever. But we know that, right? You're a great hugger.
Yes,
You're
I do
that's
know
what
that.
it is, right? Right. Healing for the ages. She's like, where's the hugger? Where's Carrie? And we need Carrie. So yeah, they got you on stage and everything. So I
I
get it.
do love me a good hug. Yes.
Yeah. So
So,
anyway,
what
so there's
what
so many more. Mhm.
what are some ways that we as
Mhm.
individuals can kind of talk to our doctor or interview a doctor? Like, what are some things that we can use as like guideposts about this is going to be a good fit or a bad fit? Like, what are some things as an individual that, because it feels really overwhelming as an individual to try and have to advocate for yourself at this level?
So yeah, that's actually a really good question because there are first of all, it's become political, and I
Hmm.
never get into politics with my patients because I don't think that's smart. We all are,
Right.
we all grew up differently and we all have our value systems based on whatever it is. So a lot of the times the patient may not know how to approach that doctor because of certain viewpoints they have.
Hmm.
And so when a patient is referred to me, I'm just listening, right? I'm
Hmm.
just trying to figure out where they're coming from. So one of the things they want to know is, what do you do for standard of care for XYZ? So if you had a patient who has diabetes, for example, and you need to go and you just don't like the doctor that you were seeing, okay, I'm just going to go there. What's the big thing that everyone's doing for weight management, which started with a diabetic drug? What was that?
Ozempic.
Hmm. So you know what that is? Do you know what it is?
Uh, I know that no, I don't know what it is. I know that it goes by another trademark name of Wegovy, but I don't
Okay.
know
Oh,
beyond
oh
that.
no, yes, yeah. Not. I did. Okay. Okay. I guess I didn't make it too specific. So it's semaglutide, right? That's it.
Oh
And
yeah,
it's a,
semaglutide.
okay. So it's a GLP-1 receptor binding product, and it's causing the patients to lose all this weight, right? Well, if you actually look up where they derive this drug from, and you just type it in, Gila monster venom. It's the
Oh,
venom from a Gila monster. So type in Ozempic, Gila monster venom, and voila, you will see that. And now CNN just reported this maybe a month or so ago. There's a 1,500% increase in emergency room visits secondary to Ozempic.
ah.
Hmm.
Well, that seems super safe and effective.
Effective in killing them, super
Yeah.
safe for the pharmaceutical companies that don't get any, a slap on the wrist and say, don't do that
Right.
again, right? And now they've got 7 new products that are actually coming out now, tirzepatide and all these different ones. And these weight loss centers. Actually, I'm working with another company who has this new handheld device that you put on through the eye and you look at the patient and it will detect diabetic retinopathy faster. Okay, so retina is the back of the eye. Opathy is disease state. So diabetic retinopathy is basically blood vessels that are exploding all over the back of the eye, secondary to uncontrolled diabetes. Okay.
Okay.
So those patients who are on, so this new technology, which is AI, artificial intelligence driven, can do the algorithms to figure out if you're going to get diabetic retinopathy at a faster rate than somebody else. It's a new
That's incredible.
technology. Yes, exactly. So I'm working with this company that it just finished their phase 3 of FDA and hopefully will be out next, or hopefully this year. I'll keep you posted. It's based out of Finland, the company. Anyway, the point I'm saying is that company actually went to different weight loss centers have now come to this company because weight loss centers don't look in the eye. They are showing an increase of everyone ending up with this ridiculous amount of blurred vision because of this weight loss drug. Okay. So they want this technology so they can check. This is a weight loss center. So when the certain studies that are now coming out are saying, oh, this drug does not cause an increase in diabetic retinopathy. No, it doesn't cause an increase. It causes it to speed it up.
Right.
It's speeding up the so it could be 20, 30 years from now as opposed to 2 years. So these
Right.
people who are taking it. So do you know the same receptor, this GLP-1, this glucagon-like peptide 1, that's the receptor.
Yeah.
You know what you can do instead of taking this medicine or this poison, this Gila monster venom?
What can
Do
you
you know
do?
the same thing that has naturally extra virgin olive oil binds to the
Oh.
same receptor as that, and you want to lose weight and you don't want to have diabetic retinopathy, take 2 tablespoons before you eat your meal and it will bind to the same receptors as that, and you keep doing that and you're going to lose weight. Also, probably getting a dog. That's the thing I say to most people, get a dog. And it's like, why get a dog? Because it'll
To
make you
make you
get off the
walk.
couch. Mm-hmm.
I
Get off
have
the
2
couch.
dogs and they get me walking every day. I love it.
Voila. See, that's what I'm saying. Maybe go to
Yeah.
a pet shelter. That little puppy needs a home. But those are the things that can help you with those patients. So now, you as a patient go ask the doctor, what do you believe in? Well, the doctor doesn't know because remember, they've been conditioned. This is how they treat. They don't even, you're just a number 10 check, get them in the room, whatever. They don't really think about it like that. So it's your job to what? Interview them. So, but you don't want to interrogate a doctor because they're like, I don't want this patient. They're cray. No. But what you want to do is like, hey, listen, I've gone to XYZ doctors and they've told me I have to take this. Do you believe the same approach or not? And let them answer. They'll say, yeah, that's what we do. I'm like, okay, that's not what I want. Or,
Okay.
oh, that is what I want. So you should do your own homework and know that do you want to go a more functional medicine route, more homeopathic route, more natural medicine route? Or do you want to go to the same, just give me a pill and I'm done? Because I do have another patient. I keep telling her, if you don't lose weight and you don't, change your diet habits, you're going to end up with this retinopathy. And she said, no, I don't have to because I can eat whatever I want. The doctor gives me a pill and I can just do whatever I want. I'm like, "Mm, mm, okay, that's no. Um,
Yeah.
and she's
That's
at
not
least
how that
200.
works.
No, no, you got to take control of yourself. You can't just,
Yeah.
and then who the one they blame? They blame the doctor. Well, you told me I could take this medicine and I can do what I want. No, they
Yeah.
didn't. You heard what you wanted to hear. But the reality is you have to take charge of your own body and you have to take charge of your own self because the government's not going to do it. Your doctor's not going to do it, only you. And so
Hmm.
eating the right way. Now, what's right way? And I hate the word diet because it's not a diet. It's a lifestyle change. If you consider food as medicine, if
Hmm.
you consider food as medicine and you take the right medicine, one, it's tastier. One, you'll eat the right amount and then you'll only eat the amount that you need because supersize it. That's the biggest detriment to the societies of, supersize your big. Okay, first of all, any of those drinks, those sodas and stuff, that's again pure poison. So
Hmm.
if you want to break down your pancreas and make sure that it's going on overdrive and not functioning the way it's supposed to, you just overload it with sugar. Another way, how to get rid of cancer? Everyone's like, oh, I got cancer, this, and how to stop the sugar.
Hmm.
Cancer feeds on sugar. So there's a
Hmm.
relation with diabetes and cancer. So you have increased risk of cancer because the sugar they call it tumorogenesis. The tumor
Hmm.
genesis means creation. So
Yep.
this creation of these tumors are happening because of the cancer. It's insane. I mean, because of the sugar. And that's
Hmm.
because of the pancreas. And why is the pancreas not working? Because you're not exercising. Okay, so there's another study that was done. It was a very simple thing. It's called HIIT, high intensity interval
Mm.
training.
Yep.
In the study, it showed that if you do high intensity interval training, so let's say you do a 30-minute walk or whatever, and you're just kind of slowly walking, you're listening to the tunes on the radio or whatever it is, if you speed it up just a little bit, pump up your heart rate just a little bit, it increases the growth of beta cells in the pancreas, which are the ones that get the insulin out and absorb all that extra sugar in there. So it's called HIT training. So if you hit the mark, you can actually reverse your diabetes naturally. It's
That's
insane.
amazing.
It is. And every time I look at it, it's like, well, I don't know why we're not teaching these patients that. No, it's easier to just give them a pill and say,
Yep.
see you in 3 months, see you in 6 months, and we'll check your sugar level again. I never want to see a patient again unless it's they're gonna, say hi, and give me some dark chocolate. I'm a dark chocolate fiend. I like dark chocolate. I love it. But those are the things you have to think about. If that's my vice, then that's what it is. But those
Hmm.
are the things you have to think about when it comes to these things, just taking in charge of your health. And I know I feel like I'm beating a drum here, but it's such a simple thing to do, and yet we can't do it. So here's the thing my dad always taught me when I was a kid. He said, a habit is hard to break. Okay, so if you word the word habit, HABIT, if you take off the H, you have a bit. If you take off the
Hmm.
A, you have bit. If you take off
Hmm.
the B, you have it. A habit is hard to break. Even the word habit is hard to break
Right.
because you still have it.
Yeah.
So instead of making it a bad habit, switch it to a good habit and don't break that habit, right?
Hmm. Right. Offer something to replace it with that
Exactly.
serves you better. Right.
No, 100%.
Yeah.
Ding, 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 nail on head. Boom.
Yeah.
Anyway. So this is just little
So
things like that.
I know with medical doctors, there's a lot of just like, I can't say it, purposeful obfuscation of, personal empowerment for their patients, right? Is that true with optometry? Is there also a kind of concerted push to disempower individuals from doing their own research? Is there like a whole trust the experts mentality in the
I think that's with
optometry
any
world?
profession. No, I think that's with
Okay.
any profession. And I do find with my own colleagues sometimes because I have to teach them, right? And so
Hmm.
I do get a little bit of pushback, maybe per se, like you're saying, because they also are drinking the Kool-Aid. And I actually allow that. I do believe if you want to drink the Kool-Aid and you want to just sip it up and think that's, the end all be all, that's okay because that's your choice.
Yep,
But don't
choice.
make me drink that Kool-Aid. That's my choice. So there's a difference in that regard.
Yes.
Now, I do believe that and each individual is the same. And it doesn't even matter in my profession or any profession. I do believe there is a concerted effort out there to make sure that people who have a different opinion not allowed to speak that opinion. Now, here's the thing though. If you can prove the results that are from that, right? If you can show that if you give a patient, ivermectin or hydroxychloroquine or vitamin C or abstaining from, certain things out there, these are the things they don't want people to know about. Now, that's when I start questioning it. Why? What
Yeah.
what is your agenda? Oh, because vitamin C or ivermectin's like 15 cents as opposed to $5,000. So I look
And
at,
the
we
patent
follow the money.
issue. Ivermectin is a generic now, and they want the new novel drugs that are under patents, and vaccines have a patent in perpetuity. So there's never any generic created from it.
Right. And so if you start saying it's not good for you, and then it's like, oh, well, now what are we going to do? Because now people are not going to take our medicine because now we're going to lose the money. It's never been about patient health. It's always been about cha-ching, the bottom line. So I would rather go to a doctor who's trying to tell me this is what I need to do. And if, again, pushing, and somebody could say, well, you're pushing vitamin C on it. But I'm like, no, I'm not. I'm telling you, this is the study. This is what I've seen. And all my patients who have done it, somehow they've gotten better. Okay. You don't want to get better? Your choice. But these are the options. I always give option A, B, C. And then okay, here's another thing. Not everything works on every single patient. Okay, I'm just going to go into something with the cornea because that's my deal. So I have a patient who has been seen by one doctor, okay, and they have severe dry eyes. And then they go to another doctor, and that doctor says, well, don't take this brand of tear, take this brand of tear. Okay, you're just basically switching bottles on them, but you're not getting to the root cause. And this is the difference. This is how you find out which doctor is going to work for you. So then I will do certain tests on that individual, and I'll look and I'll go, okay, well, do you know there's 3 layers to the tears? And they're looking at me. Nobody's told me that. All right. So the top tier layer is produced by the glands in your eyelid. Okay. The middle tier layer is produced by that lacrimal gland, which I showed our audience before, that lacrimal gland behind, and that's produced. And then the bottom tier layer is produced by cells in the white part of the, on top of the white part of the eye called the conjunctiva. When I say to them, the doctor who gave you this drop, did they do this testing to figure out which tier layer is effective? And they're like, I didn't even know there were 3 tier layers. Okay. So then I'll say, okay, well, I'm seeing your lacrimal gland is functioning perfectly fine. Your conjunctiva is perfectly fine, but your top layer, your lipid layer, is not functioning correctly behind the glands. So what we're going to do is now treat that. And they're just like mind blown. And I said, look, you're 55 years old. It's going to take you maybe 55 days before you get better because it took you 55 years to get this right. It's not going to be overnight. But if you're willing to work with me, then let's figure this out. And sure enough, even today, that's why I'm sorry I got delayed, because even today, this patient drove it. They drive him from everywhere. I mean, I'm getting them from everywhere. So she drives 4 hours to see me. And she says to me, okay, this is the first time I can wake up in the morning without my eyes hurting. The first time. And it took her 2 months. And I told her it's going to take it. You just have to be patient. You have to be consistent. You have to want to do it. Because, I can lead a horse to water, but I can't make him drink. I can tell them what to do, but unless they don't do their homework, and I even write it. I write it. Your homework assignment, and you're going to come back into 6 to 8 weeks, and then I'm going to see if and we're going to test you again. And if you're symptomatically, you might feel a little bit better, but objectively, I've got to see if there's an improvement. And voila, I saw an improvement. So then I thought, okay, are you feeling better? Because I'm seeing it's better. She's like, yes, I can open my eyes for the first time. So the same thing goes with any type of treatment, any type of medicine, any type of thing in life. You got to get to the root cause of it. And same thing with this virus. Now we know that this virus has been around, right? It's actually been around since the when did they discover it? And the electron microscopy. It was 1950s. Okay.
It's
This
been around for a
corona.
very long time.
Exactly. This is not a new
Hmm.
thing. Now, them making it in a lab and doctoring it up and making it more virulent, well, yeah, that's a new thing, and that's man tinkering with things. We were talking earlier, synthetic, right?
Hmm.
So this virus, you know how they got the name? Do you have any idea?
Mm-mm. I do
Okay,
not.
so corona, it's an RNA virus, RNA,
Yes, I knew that.
ribonucleic acid. Okay,
Hmm.
so when they looked under an electron microscopy, which is this high magnification system, they
Oh,
did
it looked like a coronal, right? Like a
corona of
sun.
the sun.
Hmm. Yep.
Exactly. So the spikes around it look like the corona of the sun, and that's how they generated the name, just because of the way it looked. So this virus has been around forever, and if it's been around forever, they needed more and more people to be exposed to it in order to build up the immune response naturally to fight off the infection. Oh, okay, fine. And if you have a good immunity, you could fight it off very quickly. If you had a bad immunity because you have all these comorbidities, hypertension, uncontrolled, diabetes, uncontrolled, you name it, whatever. These individuals who had just poor health choices leading to a poor health condition, leading to it's going to take longer. Even when I had that Freedom Radio show, I had somebody call in, my father's not well, and you keep saying it's no big deal. I'm like, no, no. I didn't say the virus was a big deal. The virus is a big deal. Okay. Taking care of yourself is even a bigger deal. So the fact that your father had high blood pressure and uncontrolled diabetes made his situation worse. So now you've got to control that in order to help it. And again, what gets affected? The eyes are affected and the toes, because they are the smallest vessels in the body. So I'll be the first one to see it, or anybody who's looking into the eyes would be the first ones to see these issues on these types of patients, and then address it. And if they do their homework like they're supposed to, they can themselves cure themselves. I know legalese, lawyers have taught doctors you cannot say the word cure, but there's so many cures out there that can help the person stay healthy and then be that all that you want to be, right?
Yeah. Yeah.
I can go on. I know. And I know I'm preaching to the choir here, and I don't mean to do that. I'm just trying to say that a lot of the times we are our own advocates, and
Yes.
we need to advocate for our health in order to stay healthy, in order to keep ourselves away from, because they're going to create another virus.
Yeah.
They're going to create something else, Marburg, Ebola, whatever it is. And all those things are going to come out at you. But you have to be stewards of your own health, and you have to take care of yourself before you put that barricade up before the marauders come in.
Yep.
The castle wall comes up, the gate,
Yeah.
the moat is, the alligators are around and everything ready to attack
Right.
them. But you have to protect your own castle, which is you. You are your
Yep.
own castle. You're the king of your castle, or the queen of your
Yes.
castle. Right?
No one's more invested in your good outcome than you are.
Yeah, don't
Or
trust
so it
anybody
should
else.
be. Yeah. Like always advocate.
But also, don't you think a lot of people have that blame game? Well, she should have told me to do this. You need to take care of you. And, I tried to do my best. We're not perfect. That's why we're always in medicine, they call it, we're in practice. We're not imperfect. If we were imperfect, it wouldn't be a medical practice. We're always practicing. We're always trying to get it right. We're always trying to learn from another person. You know what? This worked on this person. I'm going to see if I can try it on this person. Which, gives me to another thing. There's so many things like regenerative medicine that is coming out that are using your own tissues and your own cells. They're even having eye drops that are made. You draw your own blood, you spin it down, and then you remove the serum, and then you make the eye drops from that. That's your own body. Yeah, we're doing that a lot. And then now they're even doing platelet-rich formulas instead of autologous serum. Auto meaning self, autologous is self serum. So instead of doing that, I've been doing for the last 10 years now. In fact, I teach all the doctors. I've taught, I don't even know how many people. It's so many people on this, but I've been doing for the last 10 years now about regrowing corneal tissue using stem cells from umbilical cord and amniotic membrane from when the baby's born. And so I've done, I don't know, maybe 2,000 cases at least, where the tissue's damaged, and then you put it in a contact lens, put it on the eye, and it regrows the tissue, and then the patient sees again. Case
Wow.
after case, when I see that and I know I can help them, I'm like, why isn't everybody doing it? Oh, it takes too much time. You have to go through insurance. You have to do them like, then why are we doing what we're doing? We are
Right.
doing it because we have that gift. God has given us that talent and that gift, and it's our job to help those as many people as we can. Which brings me to how we met, right? How we met
Yes.
was she invited me to come to the Capitol to help testify.
Testify for some bills.
Yes,
Yeah.
and we did get something passed. So
we got many things passed that legislative session. We got 4 incredible bills passed that regular session, and we were able to go back for special session and get additional legislation passed. It was a wonderful, wonderful session this last year.
And I would like to share that one little clip with your audience.
Oh, yes, please.
Okay. All right. So let's see. Do I go to,
Go to the bottom. It says share. Oh, here it is.
There it is. Okay. So this is at the Texas Senate Committee on Health and Human Services. And one of the senators is basically asking, why are we doing this? And it's almost a glib moment in a very serious day because we were there from 9 a.m. to 9 p.m.
Yes. It was a very long day. Powerful, but long.
Yes. And after so many testimonies, it's kind of like, what are we going to say? So let's see if I can play this clip.
So you're doing your own research.
Isn't that what we're all doing here? Trying to find evidence and seeing, is there something going on? And if there is, then we need to tell people about it so they can let us know. That's why I'm working, again, as a professor, I'm working on a lecture to tell all the doctors, start looking for these things and start asking so we can get together and get this information, more numbers, more people watching it. And that's all we can do right now, unless you guys stop this fact.
So as a follow-up on other bills that have bears, as a doctor, would you want to input this about your patients, or is it too burdensome?
Saving a life is burdensome since when?
I'm sorry,
I can't.
This is the feedback that I'm getting. So
then they shouldn't be doing what they're doing. They should be CPAs or something. Sorry, sorry, that was bad.
Taking down Perry over here.
Well, I'm dealing with taxes too. It's a lot of work.
Madam Chair,
I just threw somebody under the bus and reversed. Okay.
Anyway, that was just a little kind of sweet moment, but it was true. Yeah. It was like, we were like, why is this thing still out there? And why haven't they stopped it completely?
And why is the justification for not reporting these injuries being that it's burdensome to report them?
That blows my mind. That doesn't even make sense to me.
No, and
with everything else in the world, see something, say something, except for this, hide it under the rug. That doesn't make any sense. That doesn't make any. So that's why it's up to people like you to get that message out there and just make more and more people aware, and which you have done a phenomenal job, I must say.
Thank you.
I appreciate people like you and Texans for Vaccine Choice and everybody out there.
Well, we appreciate doctors like you who continue to make medicine what it should have been, which is a partnership between the doctor and the patient with the goal of a mutual outcome.
Are you trying to say it's MAGA, make medicine great again?
Medicine does need to be made great again. There's been a lot of trust loss, and doctors like you restore that faith by reminding them that doctor-patient relationship truly is sacred, and that you are your own best advocate, and that you are wanting to work with someone who wants to work with you. And that is a message that really needs to be remembered.
Right. It is a relationship. You have to, if you don't have that trust or anything, and we it's a conversation. If, I feel like, hey, I thought this was doing well, and the patient say, you know what, I just don't feel any different. Okay. Let's, change trajectory and figure out what we can do together. But it is together.
Yep.
And if you're saying do this and they're saying I don't want to, or somebody's pushing something that you're uncomfortable with, it's like, step back.
Right.
We can't do that anymore.
Yeah.
Well, we should never have done that from the beginning. Communication.
Yeah.
Exactly.
Communicate and trust building on both sides. Yeah.
100%.
Well,
I agree.
I have been thoroughly fun fact for the day. That idea of the cornea not having any blood vessels of itself is amazing to me. I had never, ever heard of that before. And also hearing about, the vascularity, and also hearing about the differences and with the tear ducts and about the COVID vaccine injuries that are showing up in the eyes. Just mind blowing. I'm so grateful that you took some time.
And you know what's also when I do these lectures and you know, sometimes they'll type things in the chats, all the doctors, and it's like, you know, I have been seeing an increase in hemorrhages, but I thought it was because their diabetes was up. I'm like, or they've been diagnosed with hypertension. I'm like, no,
Right.
it could be with that, but I'm seeing more and more with after this vaccine. And a lot of the times the patient says, but I had the vax 2 years ago. It's taking time for it to proliferate and increase and everything. It doesn't happen overnight. So something you even done, you know, 6 months ago versus, you know, 6 days ago, there's some correlation. Some people have anaphylactic or immediate reaction. Some people have a delayed reaction. So it, you know, just to throw it under the rug is wrong. We have to pay attention. They're telling us everything they're doing. It's just for us to not wake up to that. But if there's anyone in the Houston area who needs to see me, or if anyone who wants to do a telehealth with me and not sure what to do with their eyes or the dryness, I have a lot of questions on floaters these days. And actually, I'm doing a thought or a lecture because this blue light that's emanating from these monitors and things are increasing your eyes, but it's also causing damage to the retina. So I'm working on the ABCs to help those patients. I've gotten some really great questions. So if you want to find me, go to www.docnanda.com, docnanda.com. Screen to the bottom of the screen page, and then they'll see click for telehealth appointment. I'll be happy to talk to you or anybody who needs it. If you don't have appointment time that you like, you can always email me and we can talk, because I don't want anybody to feel isolated on the island. And if you need to see a doctor in the city that you're in, luckily, since I used to speak around the whole world and probably in every state in the United States, I might be able to find a doctor that can help you. They might not be awake, but at least they're good at what they do, and they can help diagnose if there's something that we can help you with. So if I can help, I will be happy to. So www.docnanda.com. Thank you.
That's awesome. I am so appreciative of your time and of all the work that you're doing. You are extremely active in the community as a, you know, medical liberty advocate, which I'm sure you never really intended to be. And so I'm so thankful for your willingness to step out and to really fight for your principles and for the principles of all of us. If we don't have the courage to stand, there will be no one to stand for us.
Wow. That's very prophetic. That's that old expression that was said. They first came after the union workers. I wasn't a union worker, so I didn't say anything. Then they came after the laborers, but I wasn't a laborer and I didn't say anything. Then they came after me and nobody was left to speak up for me. So I'm speaking up for everybody, and everybody else needs to speak up too, because you know, there are more of us than there are of them.
Yes. And no one is coming to save us. I always say, no one is coming to save us. Whatever it means to you, we are it. And it's time that we start acting like it. We are it.
Amen.
Yes. High five. Thank you so much for coming, Dr. Nanda. I look forward very much to seeing you again very soon and giving you another fabulous hug. And anyone, again, please, www.docnanda.com, docnanda.com. She is a wonderful physician who is absolutely willing to help you be resourced or get better. Thank you so much again.
Thank you for listening to the Shot Callers podcast. Please, if you found value in this content, rate us and share the podcast with a friend. It's a great way to get the message out and to empower everyone to make informed decisions. Until next time, never forget, we are the Shot Callers.